Good evening, everyone. My name is Hilda Swirsky, Region 6 representative on the RNAO Board of Directors. I am joined by Region 6 wonderful treasurer, Marva McCalla. Anne Frank stated how wonderful it is that nobody need wait a single moment before starting to improve the world. Board of Directors, fellow RNAO Assembly, RNAO members, RNs, nurse practitioners, and valued nursing students, RNAO staff, distinguished guests, and healthcare stakeholders. It is Region 6's honor this year to warmly welcome you as your AGM host for this 91st RNAO AGM. In this three-day event, RNAO will share with you outstanding examples of accomplishments when the collective committed actions of RNAO members who do not wait for a single moment have taken nursing and the healthcare system to new heights never before imagined. You will hear in the reports from our President and from our CEO details of the phenomenal work RNAO is doing in Ontario, across Canada, and indeed around the world. They provide the vision and direction for teamwork and partnerships that advance health, shape healthcare, and put patients first. Member engagement and involvement are an integral component of the resolutions, well-researched, thought out, discussed, and created that consultative representatives will be voting on. We stop to care for ourselves, network, and have fun as we mingle during breaks and participate in the President's Banquet. On Saturday, we have a distinguished panel tackling the serious problem of Aboriginal health issues. Therefore, relax, enjoy, and participate as RNAO continues to take nursing and the healthcare system to new heights. Friends, let us all rise and welcome our esteemed procession. At this time, I want to ask that Tegan Gordon join us on stage for the singing of the national anthem. Please stand for O Canada.
Oh, Canada, our home and native land, true patron love in all thy sons command, catambrase porte le paix, il se porte la croix, ton histoire est une épopée des plus brillants espoirs. God keep a land glorious and free. Oh, Canada, we stand on guard for thee. Oh, Canada, we stand on guard for thee. Thank you. Excuse me, can't see without the glasses. Okay. One and both. Let me introduce to you RNAO President, Dr. Vanessa Rixkowski, and Dr. Doris Greenspan, RNAO Chief Executive Officer.
Thank you very much and welcome everyone. Over the next 2 days, and in the company of more than 700 registered nurses, nurse practitioners, nursing students, other health professionals, and members of the public, we will take great pride in celebrating RNAO's many accomplishments achieved together in the past year. This year, as you have probably noticed by our theme, we are celebrating taking nursing and the health system to new heights. What a fitting title for a professional association that sees it as its motto to shape healthy public policy, and one that is driven by values and armed with evidence and courage. Does exactly that, taking nursing and the health system to new heights for the betterment of Ontarians, Canadians, and, as Hilda eloquently stated, the world over. For that, you will hear me in the next few days thanking you, our engaged members, our values-driven board of directors, our evidence-based and courageous CEO, with her expert staff among you. And this evening is also about thanking you, our esteemed partners. So let me now introduce you to our special guests. And may I please ask that you hold your applause until everyone has been named. To begin, the RNAO Board of Directors 2015-2016. Carol Timmings, President-elect, unfortunately cannot be with us here this evening. Deborah Kane, Region 1. Janet Hunt, Region 2. Arik Rankin, Region 3. Veronique Boscard, Region 4. Rebecca Harbridge, Region 5. Hilda Swirsky, Region 6. Claudette Holloway, Region 7. Denise Wood, Region 9. Wendy Pearson, Region 10. Jennifer Flood, Region 11. Patricia Seaven, Region 12. Rhonda Crocker-Ellicott, Member-at-Large, Nursing Administration. Elizabeth Edwards, Member-at-Large, Nursing Education. Cheryl Yost, Member-at-Large, Nursing Practice. Angela Cooper-Brathwaite, Member-at-Large, Nursing Research. Nathan Kelly, Member-at-Large, Socio-Political Affairs. Marion Cochran, Interest Groups Representative. And Doris Greenspan, CEO. Next, allow me to introduce the members of Provincial Parliament. Ontario Minister of Health and Long-Term Care, the Honourable Eric Hoskins. Leader of the Official Opposition, Progressive Conservative Party, Patrick Brown. Leader of the New Democratic Party, Andrea Horwath. RNAO past presidents, Ermagine Bainock, Shirley Wheatley, Gail Peach, Elspeth Jensen, Valerie Smith, Charlotte Nosegard, Shirley Sharkey, David McNeil, Rhonda Seidman Carlson. Lifetime Achievement Award recipients, Cheryl Forchuk, Joyce Fox, Paul-Andre Gauthier, Charlotte Nosegard, Linda O'Brien Pallas, Shirley Sharkey, Helen Tyndale, Jane Underwood. MPPs, Gilles Bisson, MPP for Timmins James Bay. Han Dong, MPP for Trinity Spadina. Catherine Fife, MPP for Kitchener-Waterloo. Wayne Gates, MPP for Niagara Falls. Indira Nadeau-Harris, MPP for Halton. Sue Wong, MPP for Scarborough-Agincourt. Jeff Urich, MPP for Elgin, Middlesex, London. Representatives from our stakeholder partners, Miriam Botros, Executive Director, Canadian Association of Wound Care. Ted Ball, Quantum Transformation Technologies. Denise Cole, Assistant Deputy Minister, Health Workforce Planning and Regulatory Affairs. Bernice Downey, Ontario and Quebec Representative, Canadian Indigenous Nurses Association. Susan Fitzpatrick, CEO, Toronto Central Lynn. Cayenne Fu, our Provincial Chief Nursing Officer. Francesca Grosso, Board Member for Patients Canada. Michael Creek, Voices for Courage. Linda Haslam Stroud, President, the Ontario Nurses Association. Allison Henry, Acting Director, Health System Labor Relations and Regulatory Policy Branch, Ministry of Health and Long-Term Care. Paul Harris, CEO, Southeast Lynn. Maggie Kurastecki, Executive Director, Engagement and Program Delivery, Ontario Medical Association. Charlene Locke, President, Personal Insurance Practice. Bonnie Lisk, Auditor General of Ontario. Paula Masterly, Chair, BSCN, RPN Bridge and Simulation Center. David McCowan, Medical Officer of Health City of Toronto. Scott McLeod, CEO, Central West Lynn. Louise Paquette, Northeast Lynn. Denise Cole, Assistant Deputy Minister, Ministry of Health and Long-Term Care. Kim Parada, Executive Director, Canadian Association of Physicians for the Environment. Catherine Pinkleton, Ontario Association of Nonprofit Homes and Services for Seniors. Deborah Simon, CEO, Ontario Community Support Association. Andy Sloan, the Magnus Group. Roberta Tassin, the Magnus Group. Joshua Tepper, President and CEO, Health Quality Ontario. Adriana Tetley, CEO, Association of Ontario Health Centres. Michael Toth, President, Ontario Medical Association. Begin Walsh, Executive Director, Ontario Public Health Association. Andrew Valentine from Miller Thompson. Welcome, everyone, and thank you all for coming this evening to share in these celebrations with us. RNAO is delighted to have, as always, representatives from Ontario's 3 political parties in office. First, let me introduce you to our Minister of Health. Dr. Eric Hoskins was first elected to the Ontario Legislature as the MPP for St. Paul's in 2009 and was re-elected in 2011 and 2014. He has previously served as Minister of Economic Development, Trade and Employment, Minister of Children and Youth Services, and Minister of Citizenship and Immigration. Minister Hoskins is also a renowned humanitarian, family doctor, and a proud Ontarian with a long and dedicated record of public service. After finishing his medical studies at McMaster University and subsequently at Oxford University as a Rhodes Scholar, he spent nearly a decade as a doctor and humanitarian in war-torn regions in Africa and around the world. From 1997 to 2000, he served as the senior advisor to the then Foreign Minister Lloyd Axworthy on issues such as human rights, child soldiers, peacekeeping, and the landmines ban. He and his wife, Dr. Samantha Nutt, founded the international charity War Child Canada to help hundreds of thousands of children in war-affected regions across the globe. From 2002 until 2003, he was advisor to the Office of the Special Representative for Children and Armed Conflict at the United Nations. Dr. Hoskins has been recognized for his humanitarian work and public service This is important. In 2008, he was invested as an Officer of the Order of Canada. He has also received the Governor-General's Meritorious Service Cross and has been awarded the United Nations Lester B. Pearson Peace Medal. Welcome, Minister.
Well, don't be that impressed. None of that, including the awards, was for anything I ever did as a politician. But it's funny, I was just talking to Andrea Horvath a moment ago, and I often remark on how I tell people how I used to be a humanitarian, the work that I did overseas in war zones, with my wife, Sam Nutt, who's far more impressive than I am, those of you who know her. And, but as politicians, we really try, it's just a different venue, right? We try to be humanitarians and we try to find those opportunities to make a difference in people's lives. And I think that's one of the, for me it was a difficult transition, but one of the refreshing aspects about going into politics at Queen's Park is when I look around the legislature, and includes individuals like Patrick Brown and Andrea Horwath and the 107 of us, I guess 106 right now, that it's refreshing knowing just how committed and compassionate my colleagues are each and every day working. And so you should have the confidence knowing, regardless of political affiliations, we're all working genuinely and equally as hard as we can to try to provide the supports that Ontarians need or count on or should expect, or we have the responsibility to provide. Those of you who have been to question period, it might not always seem quite that way or that we're necessarily getting along. But I want to start by saying, thank you for the invitation. It's great to be here again with you. But before I go any further, I want to extend a heartfelt congratulations to Doris on celebrating, I think just last month, her 20th anniversary as CEO of the RNAO. And I know we... Putting up with you? It's all, for all of us, putting up with her, apparently. And we're all hoping we get to put up with her for another 20 years. And, but I never cease to be impressed by your outstanding advocacy. And I think, as was mentioned a few minutes ago as well, evidence-based, and you have such intent, but you come equipped with everything required to provide that compelling argument and to advocate effectively. And I know one of the issues that we're working together on and with RNAO, and I really appreciate this, it's an issue that's very close to my heart, is the issue of national pharmacare. And as I think you probably know, it's not easy. It's one I know that the RNAO feels very strongly about and has been pushing hard, and Doris included as well. And I've been doing my best as health minister in the national arena to continue to push it at that venue and at the national agenda as well. I have always thought of pharmacare being sort of the unfinished business of Medicare, which is enjoying its 50th birthday this year, in fact. In fact, it was Tommy Douglas and then Lester Pearson 50 years ago, but we have to give credit to Tommy Douglas, who really introduced Canada to the concept and the importance of Medicare, and it combined at that time and then subsequent nationally under Pearson, it was one of the, I think, best gifts that Canada could have ever received, and that hasn't changed over the course of time. But that work remains unfinished. So most recently at the federal, provincial, territorial table in Vancouver earlier this year, as part of my relentless pursuit for national pharmacare, and believing, particularly as a family doctor and a public health doctor, where I can't tell you the number of times that I've given a prescription to an individual or a family knowing full well that they won't fill that prescription because they have to choose between filling a prescription or putting food on the table or paying their rent. Or I'd go into that sample drawer that many of you are familiar with, I'm sure, and pull out something that you hope is close to what they were required to have some legitimate access to medicines. So in that January meeting in Vancouver, I succeeded, it was at my urging that we actually succeeded in setting up a federal, provincial, territorial working group on pharmacare. And that's particularly important because we're working with across the country and with the federal government on a new health accord over the next number of months. Also, Ontario is the co-chair with Jane Philpott nationally of the federal, provincial, territorial process, which includes the work that we're doing on the health accord. So I'm hoping, maybe, those of you who do know me, I'm an idealistic guy, but I'm hoping that on our 150th anniversary, our 150th birthday, what better birthday present than announcing the next steps towards realizing a national pharmacare program. And so I say that partly because I need your help, right? So the more voices that we have speaking about the importance of that. But that's a bit of an aside, because I'm here, obviously, to talk to you about nurses and nursing leadership across this province. And there's no question, it's evident that you're key partners, not just in the delivery of quality health care, but you're key partners as well in the planning and organization and delivery of the next generation of health care for all of us. And I want to thank you and commend you for the many, many contributions that you have and will be making, even to the many tables that you participate on, things like the Joint Provincial Nursing Committee, the Nurse Practitioners in Long-Term Care Homes Role Development Task Force, and many, many others. But I also want to most recently thank you for your contribution and that of RNAOs to the discussion paper that I released in December called Patients First, which looks at reforming our healthcare system, primary care, our CCACs, a stronger role for public health as well across the healthcare system. And those of you who had the chance to read it will understand and see, well, you'll see RNAO in it, quite frankly, because your white paper that you released a number of years ago, the ECHO paper, Enhancing Community Care for Ontarians, it really, to a large extent, provided us with the blueprint for when we needed to look at how to reform, particularly home and community care. The recommendations and advice that were provided in that, both not just for CCACs, but also for primary care and beyond. So thank you for that, and that's important work. And I know that that work will continue, mostly because I know that if it doesn't continue, Doris will be banging down the door to my office to make sure that we continue to make progress on that. And we hope to be able to introduce legislation shortly. So there are, I think, many, many examples where we have worked effectively together. And I'm not so naive to deny that there aren't many challenges out there as well. In our hospital system, the very real challenges that our hospital administrators and boards have faced over the last 4 years, where they've had no increase to their base funding. This year in the budget, we provided a 2.1% increase to the operational funding for hospitals. I think to state that as being long overdue is probably an accurate statement. But I recognize the challenges, and I recognize the hard work that nurses do in whatever environment that it might be, whether it's in our public health system or whether it's in our home care system or our long-term care system, our hospitals, and the list I know is lengthy, but we depend on you, and fortunately your organization is so vital and so strong that we hear from you as we need to, where those pressure points are, and not just the challenges, but also the opportunities where we can do better and where we have to do better. So I just want to touch on two things very, very briefly. I've probably already sort of overextended. I didn't plan that long introduction, by the way, in terms of the CV. But in our budget, and about a year ago, the government made a commitment on RN prescribing, you'll remember. We reconfirmed our plans in our recent budget to move forward with legislation to provide RNs with the authority to prescribe drugs, independent prescribing, and I never before understood how important one word might be. And I just recently received the report from our Health Professions Regulatory Advisory Council, and I look forward to quite rapidly moving that, sharing that with my cabinet colleagues and moving it forward so we can change the legislation that, in a way that, quite frankly, will allow for better access to care for Ontario patients. It's the right thing to do. So. And there's more change coming too, and I know with what we've called up until recently physician-assisted dying, but now it's the medical assistance in dying, that is opening up, I think, a whole other set of expectations and realities. And so rest assured that issues like nurse practitioner prescribing of controlled substances, we're looking at that as well to make sure that we're providing, again, it's having that patient centered focus of making sure that we provide the supports and we provide the scope within the practice of nursing to enable you to provide that important work and support. So, and also other important areas, you know, it was RNAO really that alerted us, and we need to catch up on issues like wound care, particularly for diabetics, and offloading. And we've got committees that have been set up, and I want to give RNAO credit to really encouraging us and giving us the kick that we need to make sure that we keep up with the science and the evidence and do the right things for Ontario patients again. So you know, maybe the last couple of things just to touch on extremely briefly is I've heard, well, I know this, being a healthcare practitioner myself as well. I know about the reality of post-traumatic stress disorder, including among those in the nursing profession. And I understand, I'm very understanding of the disappointment of many of you that that wasn't included in the recent legislation that was passed. I've heard from RNAO, I've heard from others about how important that is. I want to support you, and I want to keep this conversation, specifically this conversation, going to do what we can and ensure that we are providing the right supports to our nurses who often work in very difficult circumstances and have to confront very difficult issues that we know can lead to PTSD. So, and then the last thing I want to touch on is, which may seem like a small one, but I think it's important as well, is the issue of death certificates. And today, as you know, registered nurses can't sign them. The benefits of you being able to do so are obvious. So we're doing something about that. As part of our overall palliative care strategy, we're moving forward with regulations that will allow RNs to sign medical certificates of death in the province of Ontario. And it's a change, I know, that's been a long time coming, but it's one that really, like probably all of the other ones, just simply makes sense. So I seem to be saying a lot of that in my remarks. So you'll be hearing more about that in the weeks to come. But just in closing, let me just close by once again thanking you for all that you do every single day on behalf of Ontarians. I was fortunate enough. I wish, you know, my sister's an RN, right? So from a very, and she's 5 or 6 years older than I am. So from a very, very early age, I was instilled with a certain set of values that I attribute to her. And then I went to McMaster Medical School, to give a plug to that it was one of the first that really, I think, understood the importance of team-based medicine, and that we all are equals, and that we all play an equally critical role in the well-being of Ontarians. And so I want to thank you for being that equal member of our team, of our healthcare team. It's been a privilege to be here tonight. I look forward to being here again next year. Thank you, everybody.
Thank you so much, Minister. And I do want to make a comment that it is so refreshing, and it's incredibly important to us that we work with a minister who is so evidence-based and has so much courage. So thank you very much. I now welcome Patrick Brown, leader of the Ontario Progressive Conservative Party, to join me at the podium. Patrick was elected to City Council for the City of Barrie in 2000 and was re-elected in 2003. In 2006, he ran federally and was elected Member of Parliament for Barrie. He was re-elected in 2008 and 2011. An alumni of St. Michael's College School in Toronto, Patrick studied political science at the University of Toronto before earning his LLB from the University of Windsor. There's just a lot of, you know, good people from Windsor around. Prior to his first election, Patrick ran a law practice in downtown Barrie. As a marathon runner and an avid hockey and tennis player, Patrick has combined his passion for sports and public service to make Canada and Ontario a better place to live and work. Help me welcome Ontario's PC leader, Mr. Patrick Brown.
Well, good evening, and thank you all for being here today. I'm joined by our PC health critic, Jeff Urich, and I know Jeff was acknowledged earlier, but he is doing a great job at talking about healthcare in the legislature and constantly raising issues on behalf of physicians and nurses and healthcare practitioners, and we're very lucky to have Jeff in our caucus. And to RNAO, I wanted to say very grateful for the input we get from you. I've recently, just in the last few weeks, had the chance to meet with chapters in Windsor and Halton and met some talented nurses with great ideas for our health system, and very excited to be here today at your annual general meeting. Ontario's registered nurses, nurse practitioners, and nursing students are some of the hardest working people I know. You are always looking out for what's in the best interest of your patients. You live the healthcare system on the front lines. And I can tell you, if Doris has been in this role for 20 years, I may not be your traditional progressive conservative. If you'll notice, the issue that I've asked the most questions about in the legislature, unfortunately for Eric Hoskins, is healthcare. I talk a lot about healthcare because I'm passionate about it. And I can tell you the first place I volunteered was RVH in Barrie. And I think healthcare is the backbone of any community. And in my own office, as a reminder of the importance of healthcare, I think of my grandmother. My grandmother, when she passed away, she had a certificate on her wall, which was her volunteer certificate for being a blue coat, which is what they call the volunteers at RVH, for 45 years. And so I took her certificate and I put it behind my desk at Queen's Park as a reminder that her passion is the passion that we have in every community, that you can have everything else in life, but if you don't have your health, it doesn't mean much, and it's a priority for Ontarians. And I worry that for far too long we've been hearing the same things. We've been hearing the population is aging and has increasingly complex health conditions. We have to better use our health care resources. The dismal state of Ontario's home care system must be addressed, but I'm not seeing action or solutions. We don't see the long-term planning necessary, and it's causing weaknesses in the system that have to be addressed. I worry that the LHINs continue to fail to meet their performance targets and have allowed wait times to increase. The standard of care can be better. The inequities in access to health care throughout the province are quite significant in different parts of our province. The fact that 39% of healthcare dollars in home care don't go towards patients is a huge problem. And we're seeing it. We're seeing it across the province. We're seeing the effect of these transformations or shifts. Governments never like to use the word cut. It's always better to say transformation. But as I travel the province, I hear it. I see it. When I meet with nurses, I hear about it constantly. We've seen 9 consecutive years of hospital funding cuts, including 4 years of frozen hospital budgets. The reality is collective agreements are well beyond 0%. And so when you have a 0% with inflationary aspect in healthcare, you see a cut. And I think in the first few years, you saw short-term solutions. You saw Band-Aid solutions, whether it's not using an OR, not using an MRI machine, switching nurses from full-time to part-time, but they were Band-Aid solutions. And the result is we're at a point now where we're seeing real significant cuts that are hurting access to healthcare. Since we have Windsor here, the Windsor Regional Hospital announced they're eliminating 120 nursing positions that we can't afford to eliminate. 61 registered nursing positions were lost at St. Joe's Healthcare Centre in Hamilton. At London Health Sciences Centre, they had to eliminate 97 full-time positions, 350 frontline jobs in North Bay. We can't sustain those type of cuts. And a worrying trend is previously when they used techniques of operating room time and MRI machines and full-time to part-time, what I am particularly alarmed about today is the fact that we're seeing registered nurses being replaced by registered practical nurses at the expense of patient safety. And I'm calling a red flag on that. And let me be very clear. There is a place for registered nurses, registered practical nurses, nurse practitioners, and personal support workers in Ontario's healthcare system. All have valuable skill sets, and our healthcare system benefits from the mix of healthcare providers. However, these replacements are sometimes occurring out of desperation to meet hospital budgets, as a short-sighted way to balance budgets after years of government freezing. An example of this is the neonatal intensive care unit at St. Joe's Healthcare, who was faced with a $26 million budget shortfall. St. Joe's considered replacing RNs caring for sick and premature babies with RPNs, whose scope is traditionally focused on a lower level of acuity with more predictable outcomes. Thankfully, the hospital reassessed this plan following huge pressure and public concern on that change. But that's an example of how it can be very short-sighted. I'm pleased that Eric Hoskins today mentioned his support for having PTSD services available, access to treatment for PTSD for nurses. You have to see things that we never want to see. Like Minister Hoskins has members of his family who are nurses. I have members of my family who are nurses. And you know, we have a huge debt to you for the sacrifice you make, the things that you have to see that would shock and affect anyone else. And that's why, along with the leader of the NDP, we pushed. We were concerned that nurses weren't included in the recent bill addressing the need for PTSD. This was a unique opportunity, given the fact that the public conversation and the conversation at Queen's Park was around better treatment for PTSD, and the fact that nurses were left out of that conversation, left out of that legislation, was disappointing, and there's no other way to put it. But I also wanted to say here today that there is no monopoly on a good idea, and I've probably said that about 1,000 times around the province. And when the government acts in the best interest of healthcare, I will praise them. When the government doesn't act in the best interest of health access, I will enthusiastically criticize them in the legislature. But I'm very, very pleased that Minister Hoskins has expressed his support on the PTSD issue, on the national pharmacare issue, and also on the prescription enhancement. And you know, certainly we would be eager to work with you on expediting that in the legislature. I know the RNAO holds a wealth of knowledge, and you are well positioned to gain from that knowledge. And I know we certainly will, in our job as the official opposition. We will listen relentlessly over the next few months and next few years as we build a platform for the province and the policies that we believe could help enhance healthcare in the province of Ontario. So in closing, thank you for having me here tonight. Thank you for this opportunity. I'm actually racing to Ottawa now for events all day tomorrow, so I won't be able to join you for the rest of the evening, but have a wonderful AGM. Thank you.
Thank you so much, Mr. Brown, for joining us and for being part of our celebration this evening. Next, we are joined by Andrea Horwath, leader of the Ontario New Democratic Party. Born and raised in Hamilton, Ontario, Andrea has been a community and political leader for over 20 years. She first got involved as a community organizer for a local legal clinic to ensure all people had access to justice. After being elected to Hamilton City Council in 1997, Andrea championed projects to improve her community keep schools open, create a thriving arts and culture hub, and support small businesses. Andrea was elected to the Legislative Assembly of Ontario in 2004. Since 2009, Andrea has been the leader of the Ontario NDP. As an opposition leader at Queen's Park, Andrea has worked hard to deliver real results and positive change for the people of Ontario. Please join me in welcoming Andrea Horwath to the stage.
So I just say I get points for jumping on that stage with heels on. Good evening, everyone. Bienvenue à Toronto. For those folks who are not from this great city, I want to first of all thank President Brzezinski for the introduction. I want to applaud Vanessa on her term of office over the past 2 years. She's done some great work, so thank you for that. I think we're going to be seeing each other actually next week for Take Your MPP to Work, so I'm looking forward to that. I also want to welcome your new president, and I understand that she was unable to be here tonight, and that's a difficult thing that she's dealing with, and I know that she will, however, be a fantastic addition in terms of the leadership of this organization. I want to take the moment just to congratulate Carol for her moving to the new role. You know, together with Dr. Grinspan, 20 years of that firebrand, your entire team has done some really great work. The RNAO is not only a strong and credible voice for the nursing profession, but you're also a leader in promoting healthy public policy in Ontario, and that is no surprise. Nursing is all about doing the right thing for people. It's about making lives better, helping patients in hospitals in their own home, and making sure we address the upstream causes that impact the health outcomes for all of us. In March, I was fortunate enough to spend a week up in Sioux Lookout in the region that's northwest of Thunder Bay, and I spoke to some of you a little earlier tonight about that experience. I got to sit and talk with registered nurses who are providing care for diabetic patients in one of the most under-resourced areas, not only of this province, but of this country. I can only imagine how difficult their days are, but they are nurses. And despite all of the existing barriers to care, they have devoted their careers, all of their energy, every last ounce of themselves to taking the hand of their patients and helping them through the most vulnerable moments of their lives, because that's what nurses do. You are members of an extraordinary profession built on expertise, dedication, and compassion. And this evening, on behalf of Ontario's New Democrats, I want to thank every registered nurse, nurse practitioner, and nursing student in the room tonight for the work that you do to help Ontario patients. You do inspiring work based on an inspiring vision of building a healthier, more inclusive, and much more equitable future in Ontario. A future where we expand our proudly universal, public, not-for-profit healthcare to include pharmacare and home care. A future where we reduce disparities and reduce inequality. And a future where what's best for people is always the bottom line. Cette vision pour un milieu à venir, nous la partageons. But to do your work to the full scope, it's absolutely critical that the work of nurses be supported by the decisions made at Queen's Park. RNAO put it best when you said earlier this year that public policy is a major influence on health, and public policy is largely determined by budgets. I couldn't agree more. And that's why yesterday I launched the NDP's call to restore stable, predictable funding to Ontario's hospitals and ensure that at the very least, hospital funding keeps up with inflation and population growth. That should be the minimum standard to protect patient care. 4 straight years of frozen hospital budgets have forced Ontario's hospitals to lay off hundreds and hundreds of nurses. And that's a problem, because there's no way we can transform the healthcare system and actually improve care for patients by cutting the very nurses that provide the care. And so what we need to do is protect our hospitals at the same time as we work to meet the changing needs of Ontarians, and at the same time as we take much stronger steps to improve the social determinants of health in Ontario. You can help a patient recover. You all do it very, very well every day. But if that patient is going back to housing that isn't fit to live in, or going back to 3 part-time jobs, none of which come with benefits or security or decent wages to actually pay the bills, or going back to a life in the midst of systemic poverty and systemic discrimination, we know what the prognosis really is. Health inequities will continue to grow if we do not take stronger action to address the social determinants of health. Nous devons en faire plus. We can't just talk. We need strong action. Like following the lead of Premier Notley and cities south of the border and raising Ontario's minimum wage to $15 an hour. Because decent pay for a decent day's work or for a hard day's work is never too much to ask for. A $15 minimum wage is just one step towards building a healthier society, and it's a step we need to take to help achieve this vision that we share. The vision of a healthier, more inclusive, and much, much more equitable province. In Ontario, we can make that vision a reality. There is no doubt in my mind that that vision can become reality. And I need you to know, I want you to know, that you can count on New Democrats to work with you to make it happen. I want to acknowledge the comments that have been made both by the Minister and by the Leader of the Official Opposition around some of the work that is ongoing, some of the things that were announced today, which are interesting and quite exciting, and hopefully not going to sit on the cooker for too long, actually get implemented quickly, but also the concerns that we have, and they were raised by the Leader of the Opposition. New Democrats brought the amendment to the committee that was reviewing the PTSD legislation, and we were extremely disappointed in the decision by the majority government members of that committee to not accept that amendment. These are the kinds of things that we don't need to study. These are the kinds of things that we know already are a problem in the nursing profession. We know what kind of difficulties nurses face day in and day out on their job. We know what kind of workplaces many nurses, most nurses, face each and every day. The amount of accidents, the slip and falls, the kinds of physical demands that your jobs have that lead to injuries and illnesses that are significant. It's shocking to see the statistics around nurses and their health and safety. PTSD is legislation that responds to one piece of the kind of environment that you face in your work that can make you unhealthy and unwell. And it was a lost opportunity, to say the least, that that amendment was not accepted, and that we now, at some point, have to have new legislation or have to have some kind of amendment made in the legislature to right that wrong. But we will be pushing with you and for you to make sure that that happens. And so I just want to end by saying thank you so much for your dedication. I've had the privilege and the honor of addressing the AGM many times. I look forward to doing that again in the future. But I do want to say, on behalf of New Democrats, I want to wish you all a very inspiring and productive 91st Annual General Meeting. Thank you all for all of the great work that you do. Merci, Megwitch. Thank you very much. Unfortunately, I'm going to have to leave right away, but I do want to say from the bottom of my heart, there's a reason why nursing is the most loved profession in the province of Ontario, and I'm looking out at it right now. Thank you so much.
Thank you so much, Andrea, for joining us this evening. And now a brief introduction to our very own Judith Shamian. Dr. Judith Shamian is the president of the International Council of Nurses, ICN. We know her, we love her, and she sent us a video. Roll it.
Good evening, friends and colleagues. I'm so sorry for not being with you this year. I was privileged to be at the assembly and the opening ceremony last year and the year before. I'm Judith Shamian, and I'm the president of the International Council of Nurses. And as you know, I'm a proud Canadian nurse who are very privileged to represent Canada and the international community of nurses worldwide. ICN is the voice of over 60 million nurses across the world, having over 130 national members, associations, who are forming with ICN a strong community and a strong voice. We're continuing to work diligently and very hard to take important messages across the world. We are working on the issues of human resources for health 2030, which is a major agenda of the World Health Organization. We're working on sustainable development goals that looking at issues like poverty, hunger, education, and health that have been finalized and approved by the United Nations last September, and there is a high-level commission that's been just established and announced last month that we are very privileged to have ICN represented on, and I am serving on it as the only healthcare professional voice that takes our issues as a community of health workers and around global health, and we will take it to the UN in September this year. The Canadian Nursing Association been our member for many years and bringing the voice of Canadian nurses to ICN. The Canadian Nursing Association, with all of the Canadian nursing community, have been a very strong member. And as we speak, every day, the Canadian Nursing Association provides support to us through a secretariat right in Ottawa to support the work that we're doing on human resources for health. We are also very grateful for the work that RNAO is doing with ICNP. ICNP is very important to advance the contribution of nursing practice and the nursing profession. And RNAO been a very strong collaborator with ICNP and ICN. It is important to us to have all of the nurses across the world under the umbrella of ICN. The bigger we are, the stronger we are, the stronger our voice, and the more we can impact the global health. We need global health. While we are all organized under countries and provinces, in the end of the day, the world is a very small village nowadays. And it's only through partnership and collaboration between the OECD countries, the low middle income countries, that we will achieve the global health that will allow the 7 billion people on this earth to have a productive, useful, healthy life. So I hope you all join me in being affiliated with ICN, joining us in our major congress next year, next May 2017 in Barcelona, and continue to work together to achieve global health for all. I hope you will have a very productive few days, and wishing you all my best, and hope to see you soon. I'm really excited to introduce you to our new Chief Executive Officer at the International Council of Nurses. Dr. Frances Hughes joined ICN just a couple of months ago. She comes from New Zealand, Australia, having done a lot of work in the Pacific Islands, have done work for government, associations, in areas of policy, mental health, and other important areas. Frances is well known in the international community. She has worked diligently within the nursing community to make sure that we build the community that we need in order to advance policies within health and nursing. And now I would like to invite Frances to say a few words.
Thank you, Judith, for the introduction. Greetings from Geneva to Canada. I am Frances Hughes, the new Chief Executive Officer of the International Council of Nurses, and I look forward to having strong partnerships around the world with nursing organisations. I hope that I will one day come to Canada in the near future, and that I will be able to work and be able to liaise with organisations. Greetings and thank you very much.
It's always a pleasure to hear from Judith, and we are so proud of her to be our ICN top leader. And next, I have the pleasure of welcoming Cayenne Fu. Cayenne Fu is our Provincial Chief Nursing Officer. Cayenne is a registered nurse, a certified health executive, and a certified health human resources professional. As Provincial Chief Nursing Officer with the Ontario Ministry of Health and Long-Term Care, she provides strategic advice and nursing expertise to the government on a wide range of provincial health policy and program-specific matters relevant to nursing and health human resources planning. Cayenne's career path includes Chief Executive Officer at Yi Hong Center for Geriatric Care, Director of Nursing Innovation and Change Management at St. Michael's Hospital, and National Health Services Consulting Manager at Deloitte. She has served on the boards of Accreditation Canada, the Registered Nurses Association of Ontario, and the Canadian College of Health Leaders, GTA Executive Committee. Please join me in welcoming Cayenne.
Good evening, everyone, dear colleagues. Thank you very much, Vanessa, for your warm welcome. I'm so delighted to be bringing greetings to all of you, my dearest colleagues, as your Provincial Chief Nursing Officer. Being here this evening brings back great memories of many RNAO AGMs I have attended as a nursing student, as a proud registered nurse, as an RNAO board member, and today as your Provincial Chief Nursing Officer. Also, over the past 20 years, I've really experienced firsthand and witnessed the tremendous growth and contributions RNAO has made to patient care and our healthcare system, speaking out for health, speaking out for nursing. The energy and the support and the commitment to patient care and to our healthcare system is really inspiring. It is an honor and privilege to serve as Ontario's Provincial Chief Nursing Officer. Over the past year, I have learned a great deal from many of my ministry colleagues in the audience today, as well as many of you, what really it means to be a public servant, to serve public interest, and to uphold public trust. I have thoroughly enjoyed working with RNAO under Doris Vanessa's leadership, as well as other nursing organizations such as Ontario Nurses Association, the Registered Practical Nurses Association of Ontario, to really identify how best, as the Provincial Chief Nursing Officer, I can work with my Assistant Deputy Minister and my nursing colleagues to realize the ministry and government's vision for a seamless healthcare delivery system that truly puts patients first. I am looking forward to working with all of you as we move Ontario's healthcare, as very relevant as today's theme says, to new heights through our system transformation. Thank you very much.
Thank you so much, Cayenne. Cayenne has a very important and very difficult job, I know. Just before we close, I have a couple of housekeeping items. I remind all consultation representatives that their mandatory orientation session begins tomorrow, Friday, at 7:50 a.m. sharp in this ballroom. Others won't have access to this room until 8:20 a.m. Designated scrutineers are to meet with the chief scrutineers at 7:50 a.m. in the Johnston room. To our guests, we thank you for joining, and we thank you for celebrating with us this evening. You have all been part of our accomplishments over the past year, and we look forward to our continued partnership with you as we reach new heights. We invite you to mingle with RNAO members at the stakeholder reception immediately following the closing of the ceremonies outside in the foyer. I now declare the opening ceremonies for RNAO's 91st Annual General Meeting closed. Thank you to everyone for attending this evening, but please do not leave your seats just yet. We have some wonderful entertainment. We don't want you to miss it, and they will lead our processional out. Thank you, and good evening.